There are two residency programs here at Southern College of Optometry. One is the Pediatric and Vision Therapy residency, of which I am one of the co-supervisors. The other is Dr. Pam Schnell. And the other program is
the Vision Rehabilitation and Brain Injury residency, and I'm the supervisor for that one.
So the PEDS VT residency is really a 50-50 split residency. You're spending obviously 50% of your time in the pediatric world and then about 50% of your time in the vision therapy world. The beautiful thing about our program is that the doctors that are supervising and you're working with are in both programs. So they really do exist in both worlds.
And the Vision Rehabilitation and Brain Injury residency is focused on vision therapy and then time in the acute rehabilitation hospitals, as well as some time in adult primary care or another clinic of the residents choosing. So there are a few differences. Just the vision therapy in pediatrics spends more time in pediatrics, and the rehab resident spends more time in the rehab hospitals, but they have about equal amount of time in the vision therapy department.
Now, in the PEDS VT program, there are several kind of extra activities that the resident gets to participate in. One being our vision screening program. In the spring of the year, the resident gets to go out and help our second year students perform vision screenings at preschools, at elementary schools, really trying to enhance their skills, the second year skills, as well as their own skills. The resident also gets to participate in a new program called Youth Villages. Youth Villages is a program, it is a kind of a state-run facility where kids come with drug abuse problems, sexual abuse problems, behavior issues, and you would not be, you'd be shocked at the amount of visual issues that are in this population. So we actually have two offices on the campus of Youth Villages, which is about a half an hour away, and we're doing examinations as well as vision therapy.
And for the Vision Rehabilitation and Brain Injury resident, they spend about half their time here on campus in the vision therapy department, and then they also get to go to all four of the acute rehabilitation hospitals that our team travels to, where we get to see brain injuries and do bedside exams. The resident also gets introduced to electrodiagnostic skills and gets to follow up with their acute rehab patients here at the facility as well.
Welcome to the Vision Therapy Suite. This suite, the clinic as a whole is 15 years old, and our vision therapy clinic is actually younger than that. Over the last 2 or 3 years, we've been able to do a full suite rehab, bringing in some new equipment, bringing in a ton of new cabinets like you see here, has expanded just the amount of equipment that we can have. The suite does have 4 full exam lanes. Let me show you one. We have a full exam lane, we have digital acuity charts, and all of our rooms have wheelchair suites. You can push these back for when we need to get a patient in with a wheelchair. We have 4 doctor stations, as you can see right here. And one of the newer things that we've done is every 4th year comes in and checks out a kit. This has some basic vision therapy equipment. And obviously because of COVID right now, we're trying to reduce the amount of sharing of equipment. Our rooms have 2 boards. We have our whiteboard, where we can do anti-suppression type activities and hand-eye coordination. And at the other side of the room, we have a chalkboard, and it has a slight tilt to it, just ergonomically is better. Our room, we have lots of equipment in here. This is reading material for accommodative rock type activities, more materials, as well as down over here, we've got a ton of perceptual type of games. This is everybody's favorite Spot It, and some of which we can use right now, some of which we can't. The beautiful thing about the way our room is set up is that you see these desks here, these kind of tables that come out. This allows for the doctor and or therapist and the patient to be facing each other. We do have over here some different types of activities. This is our rotator with anti-suppression. We do have set up for Wallach rings. You may or may not be aware of that procedure. But then we have other things. We've got a bounce back. This is used, you can set it up with anti-suppression types activities. And then of course, everybody's favorite Marsden balls right up over here on the ceiling. And the Marsden balls we can control over here and do everybody's favorite type of activities, bouncing back and forth. And if we had a bunting bat, those kinds of things.
So I'm going to introduce you to one of our auxiliary spaces within the vision therapy room. So we have in this room a variety of computer-based systems. I'm going to start with this area and work around the room. So we have a dedicated computer for the right eye tracker system. A lot of times what I like to use this for is a baseline. Tells me what the patient's eyes are doing when they're moving. So a lot of really good ocular motor information, but it also gives you a sense of reaction time through some of the testing that it does. So you can play around with some different things when you're evaluating a patient, and it gives you a picture of what their eyes are doing while they're performing these activities. We have some old school equipment that's been used in some previous tests, so a lot of times we'll have some archival quality equipment in here that you're free to use and play with. Our large screen television that is not a touch screen, this houses our vision builder, our computer perceptual testing, our HTS system, the variety of different programs that we use with patients who feel like we need to have a computer base for them, but it's nice to have this really large screen so we can kind of immerse them in it. Space Owl is a program that is useful for anti-suppression. It's also useful for eye tracking, and really enjoy using this with kiddos because it's a little bit more engaging than just, for example, I'm going to draw in a maze, so they get to get immersed in the video game aspect of it. And the next large screen television screen, so this is actually a touch screen. This houses the Sanit Vision Integrator. We'll use this for a lot of eye-hand coordination, for reaction time, for tachistoscopic presentation of information. So that's a flash presentation of information that we use to help patients remember what they've seen and be able to link back to, okay, I know what I saw, and be able to put that in. I'm gonna go back to the therapy list. So again, like you can see, there's a variety of activities that you can choose from. You can also include some balance training in there with the Wii Fit board. And in this corner we have our virtual reality system, and this is really great for binocular issues, for timing issues. You get the patient into virtual reality system and they perform a game. For example, one of them is called Pepper Picker, and they're reaching for peppers, so they have their goggles and their handsets, so they're in it and they're doing the activities. We use this for patients that have had possibly have had surgery, that are trying to rebuild their binocular system, or they have a small misalignment of the eyes, or they've got amblyopia, and so we can attenuate for different visual acuity statuses, and we can adjust for dominance versus non-dominant eye, and build in some very patient-centered, patient-focused activities that really challenge them. And we have our printer here, so that's, not the highlight of the room, but we do have the ability to print paper copies of everything. We're going to go into the next room, which is kind of like, I call it the vergence and binocularity room, because a lot of these tests, a lot of the therapies that we have in here are really going to be focused on building that that true rich binocular stereo. We have behind me our silver screen, so we can project vectograms, and our vectogram machine here with our endless supply of vectograms, our glasses. We have our movable forest and our Wheatstone bridge. We've got cards for the Keystone machine, so we have that also. Like I said, we have a variety of machines that date back further, so you can try out some of these machines and see if it's something you want to incorporate into your practice. And obviously our projector, and multiple stereoscope options that you can play with. So a mirrored stereoscope over here, and on this side over here we have the stand stereoscope with our cards, and you also see a couple of stacks of plates that are used in our, it's got a couple of names, our synoptophore or amblyoscope. So this, I like to use this with people that have kind of weird binocularity, like they have weird alignment. So if you've got a hyper and an ESO or an exo layered together, you can get, you can adjust these so that you can put the images where the eyes are and start to build a fusion sense for the patient. So this is a piece of equipment that I really do like to use for some of those special patients. We also have in this room one of our smaller rotators. We've got another rotator out in the main therapy room, so we do have things that we can do for oculomotor, but a lot of what's in this room is really for building that rich binocularity.
Hi, I'm Kristen Adams, and I'm an instructor here at SCO. I previously was a resident, and I loved it so much that I'm back. So if we look here, we're coming into the room with a Benovi. So we have some technology that we really love here. We have the double Benovi, which we can control with the tablet. So like a Wain's-Catic fixator, being able to look at saccades and reaction time. And we also have in here the realizer. So we can actually look at the reading eye movements of a patient for diagnostic purposes, and also to help explain to a patient's parent. We also have some other tests in here, and that are all organized that you can be doing with your patients in an evaluation. And then we have out here another piece of technology that's somewhat similar to the Benovi, but this is called the reflection. So this is even larger, and patients can use the whole thing. So in essence, we can be touching spots all across. And all of this equipment is able to move up and down. So it's really great. We get to incorporate tons of technology here at SCO.
I think one of the highlights of both programs is the level of flexibility that we have. Certainly there are things that you have to get done just based off of accreditation, certain numbers that you have to hit, but the resident gets to kind of help craft their own program. We've had residents been a part of adult primary care, electrodiagnostics, helping to teach in some labs or some classes, and that's it kind of depends on what the resident wants.
I think another really unique thing about the program here is the amount of time that both residents get to spend in the vision therapy department and just the vast number of patients that they get to see. We have a very busy vision therapy clinic, and so the residents really get to experience working with patients with all different diagnoses and seeing multiple patients at a time, and really getting a strong experience in vision therapy.
We have a vision therapy department. So some other programs set it up where they have an autism day, or they have a special needs, special brain injury day, or an amblyopia day. We have vision therapy. So, for example, this morning, I know that there was an autistic patient, there was a brain injury patient, a patient with strabismus, amblyopia, and then just your basic learning-related vision problems. And it very much mirrors a private practice where you can get those back to back to back. So it really does throw a lot at you, and you have to kind of change hats based on diagnosis, but then based on age too, because we will see patients from 3-year-old esotropes to 90-year-old brain injury patients. So it really, a lot comes at you, but the doctors, including the 2 of us and the other 8 doctors, we're there to help you every single step of the way.
I think another really cool thing about the program is the number of staff doctors that the residents get to work with. Here at SCO, we have doctors that went to school and did residencies at programs across the country. So we all have different backgrounds, and we really get to highlight the things that we might have learned a little bit differently, or our background, and they get to experience all of those different things here in the clinic at the same time, which is really cool.
It's a real pleasure to be working with so many wonderful other faculty here as part of our vision therapy and pediatric clinic. You have people with lots of different backgrounds, which is a real strength of our program here at Southern College of Optometry. We're not all cut out of the same mold, and that will give you the opportunity to have multiple different experiences and different ways of looking at case analysis as you work here. We have a very wide background in terms of years of experience, from people like myself with the white hair, who's lots of experience, and Dr. Glenn Steele, all the way to some of our own residents coming back to be on staff with us, who are absolutely wonderful. So it's a pleasure to welcome you to Southern College of Optometry and to be part of an absolutely wonderful cast of faculty here.
Southern College of Optometry is proud to note that we offer the largest amount of residency programs, along with the largest number of positions in those programs. But we're equally excited that we fill those programs with the best and brightest young optometry graduates from around the country. SCO offers 8 campus-based programs for 2021-22. 3 of those are the vision therapy rehabilitation programs, but you also get a wide variety of exposure to contact lenses and adult primary care and pediatrics and teenagers. You will get the pleasure of learning from a robust and diverse amount of faculty members, as well as serving on call throughout the program, so that the program really is very robust and very widespread in terms of the exposure and experiences that our residents are able to have.
I came from a much smaller school. Our class size was a lot smaller, so coming to a place where there are a lot more students, there's a lot more faculty, it could probably be overwhelming for some people, but for me it's been seamless. It's been really easy to adapt to. I've had nothing but positive experiences here so far with it. Well, what's really interesting here is, unlike really any other school that I looked at, this one actually sees the most brain injury patients, which is what I want to see all the time. So I actually get to go and see that population out at the rehab facilities right after they have injuries, and then I get to see them kind of for their long-term stuff here at the clinic, because we'll do rehab therapy over here. So you really don't get access to that kind of population really at any other school, or there's just so many, there are so few places within the country that you actually get to work with that kind of population so closely. So that's what makes it really unique here.
I had great recommendations regarding this residency program, so definitely some of the doctors that I've worked with in the past, but more than that, I was really interested in a program that did both pediatrics and vision therapy, and I thought this was a really good breakup between the two. And you work with a bunch of different doctors instead of just a couple doctors, so you can get a lot of points of view, and then you can use those points of view to decide what kind of doctor you want to be moving forward, which I think is a great thing about the residency here. And then I also just really liked everybody who I talked to the day that I came here, and for me, the people that you're going to work with every day is kind of the most important thing.
I've been at SCO 2 different stints, and one was in the 80s from 1987 to 94, and the second was in 2007 to present. And the difference in the institution from the first time to the second time is totally incredible. In fact, the building we're standing in as I speak was not here when I was here the first time. Even though we were founded in 1932 and therefore one of the oldest schools in the country, it's amazing the growth that has occurred. We used to have a clinic that was the first floor of a building, and now we have an entire 3-story building that represents our clinic. Same thing with the classrooms. We used to have these antiquated old classrooms that now we have state-of-the-art, where we can get, if we open the doors or the wall in between, we can get about 250, 300 students in at one time if we need to. So it's a place that is very stable and a place that is cutting edge as far as optometric education. We feel like we're one of the best schools in the country, and we can say that without any hesitation. But the funny thing is, in 1987, we could not say that in any form or fashion. So I think a lot of institutions do an up and down, and we did our down many years ago, and now we're up, and I just can't see it changing any over the next, several decades. And the one thing you have to know about Memphis is it's a southern city. And when I say that, I mean all the good things that you hear about cities in the South. The people, first of all, we're always one of the friendliest cities in the country. We've gotten many awards for our charitable nature. We give more money per capita than most cities in the country. So there's this tight-knitness of being a southern city, and then when you throw in the Mississippi River and all that that brings with it, and then you add in all the cultural variations that we have, the diversity in this city. I live in Midtown, have never lived anywhere in this city other than Midtown. And Midtown is very similar to a small southern town that you plop down in a big city. And that's because there are no malls in Midtown. It's mainly mom and pop places. It's mainly a lot of trees, and you don't realize how important things like trees and thunderstorms are until you live someplace that doesn't have those things. And you realize those are an important part of your life. And when you go out into Memphis and into Midtown, if you go to the 11th story of our academic tower and look out, it looks like you're in a forest. And in reality, you're in the middle of a city. So to me, having that little small town feel, there are 2 liberal arts colleges in Midtown. There are tons of unique, independently owned. The oldest bookstore in the city is in Midtown, founded in 1890 something. So Memphis is a typical middle-sized city. You may come from a large city and think, what am I going to do there? Well, we actually have a little bit of everything. We may not have 2 or 3 professional sports teams, but we've got a professional sports team. We may not have 50 art galleries downtown, but we got a lot of art galleries downtown. So you can't look at it and think, oh, it's just a tiny little nothing town, because that changed many, many, many years ago.